Hi, good morning and welcome everyone. My name is Dr. Martha Staley. I'm the director of the School Mental Health Initiative for the New England MHTTC, and I'm located here at the Yale School of Medicine in New Haven, Connecticut. So good morning, or as someone wonderfully put in the chat, good rising to you. And we are so glad that you are here with us today to talk about how we begin to advocate for mental health literacy within our school communities. Maybe you're just joining us for the first time today, or maybe you had a chance to join us in our introductory session to this series, but this is part of our Take Heart Ambassador Program series, which is about becoming more empowered, more educated about advocating for mental health services and supports within our schools and in our broader communities. I encourage you, if you have questions, please do put them in the chat. If you have a technical issue, please let Ingrid Paget know. And this morning, if you want to put your name, where you're from, and what you're hoping to learn in this session, that would be great. Just drop that in the chat. I wish we had a chance to get to know all of you, but we're so glad that you're here. Today, we're going to just give a very brief background about who we are and why we're talking about this, if today is your first time joining us. We're going to talk about what mental health literacy is and why it's so essential to beginning the process to advocate for mental health supports and compassionate schools. We're going to talk about the steps that you need to think through in order to begin advocating for mental health literacy. We're going to talk about a program that we offer free of charge within the New England MHTTC called Classroomwise, as well as some additional resources, and have some time hopefully for some question and answers. Everything that we're talking about, our resources, this presentation and the recording will be available for you within a couple of days. We'll send that out, as well as some tools that we hope you will find useful. And don't forget that after the session, those are our office hours. We invite you to bring your questions, challenges, solutions, anything that we didn't get to within this 1 hour that we have together to discuss this very complicated issue. So please join us for that. If there's anything that you want to ask or share, or if you would like a chance to connect to us or your colleagues around the country, we're so glad you're here. Again, ask questions in the chat if you have any. And then we'll give you a chance to unmute microphones and ask in our Q&A section of this webinar today. Just as by way of introduction, this is our MHTTC School Mental Health Initiative. MHTTC is funded by SAMHSA. If you are not from the New England region, you have an MHTTC that focuses on school mental health in your region. As well as there are 2 additional centers across the country focused on Native American and Indigenous peoples, and also Latinx and Hispanic communities. So if you are looking for ways to connect to people in your area, please let us know, or you can find out more on the website. Our mission is to develop and disseminate evidence-based resources to enhance school culture. Everything that we do is evidence-based and it's freely available. Please take it, use it, distribute it, and be in contact with us if you're not able to find something that you're looking for. Our goal is to prepare the school mental health workforce to extend our trauma-skilled practices, to promote equity, to promote well-being for all members of the school community. And I'm so glad that some of you are putting in the chat what you're hoping to get out of today's session. I see some hoping to gain knowledge and resources that you can share and disseminate. Absolutely, we hope to bring that to you today. What we're really talking about is creating compassionate school communities that are not only focused on academics and knowledge, but also focused on helping kids, families, and school staff develop the skills, the awareness in order to promote their own wellness and mental health. So we believe that that begins with an understanding of the neurobiology of trauma and also the neurobiology of resilience and recovery, understanding the benefits of using a mindful approach to transformational leadership, thinking about how we can get all of our collaborators and partners beyond the school to help us in that effort, and work with all members of school communities to create a vision for our schools that centers on well-being and learning. And that includes families, students, staff, community-based organizations, and members. Why are we talking about this? Many of you know, but I think it's always important to come back to why this is so important. It's because of the mental health crisis that we are all facing within this country and beyond, and particularly the burden that rests on our young people. Before COVID, 1 in 5 youth experienced a mental health challenge. We're now up to about 37 to 44%. I expect that that is going to grow. All of us are aware of the collective trauma that we have experienced in the last couple of years. And we are really seeing in our schools what has happened as a result of that, the ways that our kids are disconnected or having trouble reorienting, or the ways families have not been able to prioritize wellness or well-being. We know that those issues disproportionately affect some of us more than others. And so we believe that focusing on equity is an important component of wellness and well-being. And we know that our kids are really in a crisis, as are our school staff. Those of you who are working in schools, we know that you are feeling the burnout, the stress, the exhaustion, sometimes the frustration and hopelessness. And we hope to create a community where you can talk about that, express that, and get some help. We are all feeling stressed. Many of us are coping with depression, trauma, anxiety, difficulties with concentration and learning. And again, that extends from the kids in the smallest, youngest grades up to all members of our school staff. So we need to work together to really focus on raising awareness of what these issues are and advocating for additional thoughtful, compassionate supports. So how do we begin to do that? We begin by increasing mental health awareness and literacy. Everybody in school communities, we hope, will have a chance to learn more about mental health, what to look for, what to be aware of. We want to increase stakeholder outreach and engagement. So we think it's really important to be checking in with all members of the school community, including staff, educators, administrators, but also families and students themselves. What's important to you? What are you struggling with? How can we help? And we think it's important to develop advocacy platforms and think about what are the concrete steps that we need to engage in order to make our schools better, healthier, and safer. So we're going to begin by talking about mental health literacy today. I'm not talking a lot about what mental health literacy is or necessarily trying to raise your awareness of what mental health literacy, but we are talking about mental health literacy and how we are going to begin to advocate for programs that increase our awareness of mental health issues within our schools. If you are looking for resources on increasing your own mental health literacy or that of your staff, we absolutely have those too. But today we want to focus on the practical nuts and bolts of how we get more of this information into schools and into the hands of the people who need it. So what is mental health literacy? Mental health literacy focuses on the recognition, knowledge, and attitudes around mental health. So mental health literacy helps us recognize mental health problems and symptoms, sometimes in a way that prevents them, sometimes as they're emerging. We want to be aware, we want to increase our awareness when somebody is in distress, particularly children. We want you to know and your staff to know where and how to seek mental health help and information. So where do you go when you see an issue? We want to reduce stigma around mental health conditions. We want people to feel like it's safe to talk about these things, to talk about their own experiences, and to get the help they need. We want to promote recovery and resilience. That's what we're really focused on, not just the absence of symptoms, but the promotion of well-being, of strength, of hope, of resilience. We want to strengthen our overall wellness, including our own physical, mental, and emotional well-being. And we want to increase the understanding that mental health problems can and should be treated. They can be treated. There are a lot of options for treatment that include things from formal clinical supports to additional skills building and natural supports. So now the nuts and bolts, how do we begin doing that? We've laid out about 6 basic steps to get you started. Included in your packet of information that Ingrid will be sending to you in the next couple of days, that includes this video, our slides, and resources. We'll also have an action plan worksheet that you can fill out that contains this information on it. So you can begin really thinking about the concrete, how you begin doing this. Again, we're assuming that many of you are not quite sure where to start. Some of you may have already begun this process. Your schools may be already engaged in mental health literacy options. So we hope that this will, if you're already engaged in this process, that this discussion will help pique some of those questions and draw your attention to the elements that might help you strengthen those existing programs. So we'll talk about each of these things in more detail, but we're beginning by identifying what is your goal for your mental health literacy awareness program. What is the context? What is the landscape into which you are trying to implement a mental health literacy program? Who are your partners? Who are the people with whom you'll be working and collaborating to do this? Because we know you cannot do it on your own. How do you back up your position with data and information? You know, it's great to want to do this and to value it, but we need to have real world information about what are the issues and what can we do about it? What's the impact? We have to think about how we're communicating these things. How are we telling people about this and getting them engaged in this process? And we want to help you find the right program, and we have a couple of suggestions for you there. Again, if you're just joining us, please feel free to put your name and location in the chat and anything that you're hoping to get out of this session today. And also, if you have a question, if I'm throwing a lot of information at you quickly and you have a question, or if you have a resource that you think might be relevant, please also share that in the chat. This is a great opportunity to share some of those programs that you know are out there and working. So we hope to hear from you. So the first thing that we want to do is begin by thinking about what the goal is for our mental health literacy program. What is your motivation? Are you implementing mental health literacy because it's a mandate from your district? Are you doing it because you've had challenges or incidents within your own school community that you're responding to? Are you doing it because you are somebody with your own lived experience and know how important resources and help and literacy is? Are you an educator who wants to expand your own knowledge base and you think that other people need that same opportunity as part of just thinking about the health of your school or of your organization? So have a firm idea of what it is that you're hoping to gain out of this, whether it's just a change in knowledge, whether it's a change in attitudes or a change in practice. Think about who your audience is. Are you trying to gear this to all the members of your school, including students, families, educators, staff? You want to think about what each of those segments might need. And, you know, if you are just beginning this process, I urge you to think about going small to go big. So pick one of those audience segments and start there and use that to learn more in order to expand what you're doing. But you really have to think about what the audience is, because different audiences need different kinds of information. What's the format of your mental health literacy programming? Is it going to be a particular curriculum that's already developed that you're implementing? Is it going to be a professional development opportunity that you're asking your staff to engage in for an afternoon or a day? Is it that you want to infuse mental health literacy into all aspects of your curriculum or your curricula? So think about what the format is that you are hoping to deliver this, how comprehensive it is, and what your resources are in order to do that. And then you want to think about how you're going to know when you're successful. Okay, so you want to not only deliver this, but you want to be checking back in. If you deliver a mental health literacy program, you want to make sure that people actually have more knowledge and information as a result. So how are you doing that? If you're using a program that's already developed, there might be evaluation tools or tests. You want to just keep in mind being able to demonstrate that mental health literacy programming has been delivered and it's effective. So, and I know again that I am covering a lot of information. I urge you to take what you like and leave the rest, and also know that you'll have a chance to look at this. I want to cover as much as I can so that you have sort of an awareness of where we're going, but don't panic if you're not able to answer all of these questions, or if I'm moving really quickly. You'll have a chance to come back to it. So after you've identified your goal for your mental health literacy program, and keep in mind, these are all the things that we are thinking about in order to be able to advocate for implementing this, or being able to convince our staff to engage in this, or being able to convince families to engage in this. So having a clear purpose is the first important step. The second is getting a sense of what the context is in which you are delivering this. Does your state already have policies that pertain to this? Are there mental health days that students can take during the school year? Do you already have wellness-centered or mental health literacy programming that exists within your school or your district? Are you aware of what the different cultural landscape is within your populations? Are you aware of basic things? Who speaks what language? And so what materials need to be in what language in order to reach them effectively and in a way that is culturally competent? Are you taking into consideration the additional mental health considerations of some groups of folks within your school community? If you happen to live in a community with a high refugee population, that's something to keep in mind in terms of your mental health literacy efforts. If you are in a really rural area, you need to keep that in mind, because obviously what you're talking about in terms of mental health literacy and mental health literacy and supports is going to depend on your individual context. You have to have an idea of what mental health supports are available. If you are the school mental health clinician in your school, do you have other clinicians who are available to answer questions, offer support? Are you on your own? Are you even in a school that doesn't believe in including these things in your school curriculum? All of those elements are really important to be aware of and to think about before you begin, so that you are prepared when you meet resistance, when you meet a need with no clear solution. You have to have an idea of what the challenges are in your own school community. And there are many, many challenges out there, as we know, from, again, not thinking that this is the role of schools, to being in school communities with a very high level of acuity and a lot of children for whom you're very concerned. Those are important challenges that you need to acknowledge, and you need to build into your discussions about mental health literacy in order to develop programs that meet people where they're at and really meet the need. Again, if you have any questions, please let us know. I see Sarah Hines has put in the chat her contact information about resilience coaching, which is awesome. If you happen to put in a resource or a contact into the chat, we'll make sure that we pull it out and provide it in our follow-up materials for you, because there are so many people and groups doing this work out there who can help you. And that leads into our next point, which is about finding partners. You can't do this alone, right? You know, or I should say, very few people can do this on their own. We need to identify who in our communities, who in our schools, who amongst our families and parents, and who in our students are available to help us. And that help can be from professional help and resources to encouragement and advocacy, to sharing their own lived experience and contributing to the stories and the data that are so important in sharing this kind of information. So you have to think about who needs to be convinced to implement these programs and what are their goals. If you're in a district that has administrators that need to be convinced, their goals might be meeting, you know, the policies and mandates that are handed down to them from the states. It's a great idea to know what those are so that you can address those very directly and talk about how what you're offering directly meets those needs. If you are working with people who are concerned about the price or the cost of these kinds of programs, having an idea of what is free and available is really important. And make sure that when you're thinking about your collaborators, that you are making a team, ideally, that includes people in all of the different stakeholder groups. So having families on board, engaging community organizations, community health partners, engaging students, engaging other teachers and administrators, all of those are important partners in thinking about this process. And then thinking about how you can best work together. Is it regular meetings? Is it a committee? Is it focused on advocacy or going to school board meetings? Is it meeting individually with folks? So really lay out a plan of how you can begin to mobilize the team that you're thinking about. And an important piece of that, as you're beginning to think about this team and as you're thinking about the needs of your school community, your administrators, your staff, don't forget the data. And I want to be really clear that the data is absolutely the facts and figures about, similar to what I presented at the beginning about the tremendous need that's out there and the lack of resources available. But the data are also the stories and experiences of the people within your communities. So, you know, we think of as a researcher, I think of, you know, data changes minds and stories change hearts. And so think about that narrative piece and how you can use those things together to begin to change people's minds about how important this is and why this is essential that we do this now. So figure out what the data is for your particular group. If you are working in an elementary school, what are the mental health data for elementary school students or elementary school staff? Identify what's current. Are there particular current incidents that you're responding to that might include things like school violence, a suicide within your community, something happening within your own town, your own district or state. So have an idea of what the data is for those, what the data are for those particular contexts as well, and focus on the effect. So we don't want to deliver mental health literacy programming just for the sake of having done it and checking off a box. We really want to see some examples of the effect that mental health literacy has. So we want to see, are people asking for help more? Are they more able to have discussions like this? Are they more aware of things to look for and where to go if they see those kinds of things? How can you connect your ask for the programming to the impact that you're looking for? A reduction in class disruption, a reduction in the anxiety and depression of your students, an increase in test scores or productivity or ability to concentrate. Those kinds of impacts are really important to think about. And as you're bringing these things together, you want to think about how you're communicating this. So who needs to know about what you're doing and when? If your mental health literacy programming is focused on staff, how are you communicating with them? How are you drawing them in? How are you engaging them in deciding what the programming is? If your mental health literacy is extending to your whole school, how are you talking to families and parents? How are you telling the kids about what's happening and why you're doing this? How are you announcing initiatives like this? Are you issuing press releases? Are you including it in school newsletters? Are you including it in the announcements? Are you including it in aspects of your curricula that move beyond just health class? How can you communicate this in a way that expresses the urgency of these issues, that's brief enough for people to understand, and in a way that's compelling? And we have a lot of resources that are available that we are developing and have developed at our website, which is heartcollective.info, that we hope you will come visit. Or if you found your way to us from there, please go back to look at some of the things that we've provided that can help you figure out what a press release would look like, how you would include it in your newsletter, how you begin advocating, overviews of what the data are if you're looking for that. And how can you let people know about what the program is and what the feedback is? So if you are doing a staff-wide mental health literacy program, how can you communicate to your larger school community? Hey, all of our staff have gone through this. As a result of this program, 100% of our staff are now better aware of these issues and know what to do in these kinds of situations. You want to be able to celebrate those successes and celebrate the progress that you're making towards increased knowledge and increased putting this into practice. So, and how are you getting feedback from folks about how this is working and what their experience is from it? So think about that communication strategy as you're beginning this programming. And for those of you just joining us, I'm so glad that you are here. Please feel free to put your name and location in the chat, as well as what you're hoping to get out of today's session. And be aware that you're going to get a copy of the video and all of the slides, but also an action plan to help you think through some of these questions step by step, so that you can begin the implementation or strengthen the implementation of your mental health literacy programming. And please do, if you have any questions or if something isn't clear, please drop it in the chat and join us for the office hours after this session. So you've done these preparatory steps, you've thought about your audience, your context, your communication, the data. Now you're at the point of thinking about what your program is going to be. And there are a lot of programs that are available that are excellent, that are evidence-based, and lots of consultants who are available to help. We have some of those folks in the chat who are willing to answer questions, provide guidance and resources to you. But there are a couple of things you have to think about as you're thinking which direction to go. Your target audience, we talked about that a little bit. The specific needs, context, and goals of your school. So what is the overall landscape of mental health literacy that your school already has? Does your staff already have some of this professional development and you're looking to supplement it? Are you meeting the needs of the diverse cultures or the challenges that exist within your own school system? Think about the length of time and the effort availability. Like, we're very aware, and of course you are all very aware, that school staff, school adjacent staff, community health organizations are really at their limit and overwhelmed with information and things that they need to do. So it's important to think about, when you're thinking through this programming, how much time are you taking? How much effort are you asking of folks? You want to find something that meets the needs, but isn't too labor intensive, doesn't add to the additional noise, is something that is going to be impactful and relevant to them, something that is actionable that they can use immediately. So is that a focused PD effort? Is it an ongoing community of practice within your school, or something like a book study? Is it hosting an open house for your families, or a health fair for your families with resources? Think about what you yourself, what your group of champions and what your school community can reasonably handle, and set your expectations there. Again, operate from the idea that you go small to go big. So it's okay to begin in a small way, getting mental health literacy just into your health classes, or putting up a bulletin board with mental health resources. Those are all reasonable, important ways of beginning this work. Think about your budgetary concerns. Some of you have been able to put aside some money for consultants, for coaches and mentors, for really intensive programming and technical assistance. That's great. Some of you have a budget of $0. So you have to kind of be aware of what you're working with. There's a big diversity of the resources that we have, and there's something for everybody at every level. Again, even if it's a list of resources within your school newsletter, or making sure everybody in your school knows what mental health supports are available. Those are all parts of implementing mental health literacy within your schools. And have an idea of the degree of follow through and engagement you're looking for. Are you trying to raise awareness and increase knowledge? Are you trying to change the way people practice within their own disciplines, whether it's as a teacher, as an administrator, or as a clinician? So again, be realistic, but also optimistic about what your resources are when you're thinking of a program, and know that wherever you're starting is the right place to start. So with that in mind, I want to tell you about a program that we have been actively developing along with our colleagues throughout the MHTDC network across the country, that we have worked on and published last year. It's called Classroomwise. It is a free 3-part national training package for K through 12 educators and school personnel on mental health literacy. So it is a great beginning package, 3 parts. I think it's maybe 5 or 6 hours of total material for everybody in your school, from administrators to paraprofessionals to bus drivers and kitchen staff and custodial staff to teachers. This is a great place to start for anybody in a child serving system who needs a beginning idea of what mental health literacy is and how to start. So I want to tell you a little bit about that and how you can access this. We spent a lot of time not only talking to experts in this field, but talking to students and families and educators and school mental health clinicians across the country about what they needed in a sort of, I don't want to say post-pandemic world, but in a world where we have all been through this collective trauma over the last couple of years. So in a way that is a low burden, high impact way. All of these things are linked within these slides, but the website for this particular program is classroomwise.org. And this is an online self-paced course that you can do. You could do it on your own. You can do it as a group. So going through the modules together, you can do it as part of a study section or as part of a PD program. But there's an introduction, it's multimedia. So there's not only opportunities to check your progress, but also videos, great interviews with educators and students and families about what they need, what they've learned, and about mental health literacy generally. Along with this program, There are tons and tons of resources that are vetted, thoughtful, annotated bibliographies of resources on any topic related to school mental health and increasing school mental health literacy. They're all evidence-based resources and really, really comprehensive. So you can access those resources even if you decide to take the course or not, but there's a lot of really great stuff there. And Ingrid has put the overview and the URL in the chat. We've gotten a lot of feedback from educators and school personnel about how helpful this has been, how implementing this within their schools has created a community that is thoughtful, aware, and compassionate, how it's really transformed a lot of the conversations that people are having about mental health within their schools, including how they're talking about their own mental health as educators and school staff. There are 6 modules. The first 3 are about promoting mental health and well-being of students, about creating safe and supportive classrooms and bringing mental health into the classroom, addressing stigma, fostering social emotional competencies. And then modules 3 through 6 are about not only the general awareness, but also understanding and supporting students who are actively in distress and experiencing adversity. So understanding more about trauma and adversity on learning and behavior, understanding and identifying students in distress and figuring out how to link those students to support, how you think about classroom strategies to support students with mental health concerns. So beginning to create those on the ground strategies to help support students. Again, this program did come out last year, but we are offering a specific Classroomwise technical assistance opportunity. If you and your organization or school would like to participate, we're inviting 20 schools from across the country to help understand what types of assistance they need in terms of Classroomwise and implementing it and increasing their own mental health literacy across school communities. It's all free. They're asking for a small leadership team to engage in this. You get guidance that is specific to your school, coaching, consultation, webinars, written guides, opportunities to ask questions and get technical assistance, individual meetings with the developers if you have particular issues that you're focused on and need some help with, and an opportunity to give feedback to improve the course in the future. So if you are interested in doing that, it's not a huge ask of your time and effort. It's just an opportunity to implement this with a lot of additional support. If you're interested, you can complete the application here. That's a live link. Or you can go to the Classroomwise website or the MHTTC website. We'll include a link for it to complete the application or to ask further questions about what it might be. So we're hoping that you will consider that if you are looking to implement that. We did have a TA assistance opportunity last year, and the schools that participated said that they were just blown away by the changes that they were able to see within their schools and the access to really specific resources and consultation in a free, easy to use way. So I urge you to ask questions about that or to complete that application if you're interested. And I am going to pass it over to my colleague Ingrid to tell us more about our own initiatives before we open it up for questions and answers.
So thanks again for joining today's session. For your review, of course, we've highlighted resources from the broader Mental Health Technology Transfer Center like Classroomwise, but we also invite you to learn more about and enroll in the New England MHTTC's online course, Cultivating Compassionate School Communities that Respond to Trauma Effectively. Our 12-hour course offers recommendations to cultivate a compassionate school community, to help you buffer against the negative effects of trauma, build resilience for all students, and really provide stress relief and enhance well-being for teachers and other school personnel, as well as students. And the course offers 12 CE credits upon successful completion. Thanks, Martha.
Thank you. In addition to our course, which is on the Healthy Knowledge website, we also are offering more additional resources within the Heart Collective, which you can access through the heartcollective.info website or through our MHTTC website. We are continuing our Take Heart Ambassador series, which is focused really on the support and the nuts and bolts training and technical assistance that you need in order to advocate for school mental health and implement school mental health opportunities. So this Take Heart campaign and ambassador training promotes well-being, advocates for improved school mental health supports, gives you access to evidence-based strategies, increases stakeholder involvement, and through, which is the one with 12 CE credits, and is that free? That is our course. I'm going to ask Ingrid if she can put that. There's the link to more information about that course. And that's a great way to also get started on mental health literacy. And it includes some of the basics of mental health literacy, but then some more advanced techniques and opportunities for implementing compassionate, trauma responsive, evidence-based practices within your school. So within our Heart Collective initiative, we would love to have you join us to get educated, to work on engaging and listening to stakeholders, to vision, plan, and monitor your progress, and to promote hope through mental health literacy. So our Take Heart Ambassador series is focused on concrete advocacy strategies, professional development, and includes access to talking points, infographics, data, other materials to help you do this effectively. We want to make it as easy as possible for you and your school communities to advocate for what you need and get connected to supports and resources. So this is the first content-focused session of our Take Heart Ambassador program, but we do have upcoming sessions that we hope you'll join us for, focused on activating your power and operationalizing stakeholder engagement. So that really focuses on that connection piece that I mentioned in your advocacy, and then talking about creating a vision and planning and monitoring for success as you are increasing mental health literacy, awareness, and mental health supports, how you can really be a powerful, thoughtful, educated advocate with strategies and tips for that. Again, all resources are freely available. Please disseminate them, use them for whatever you need. And we hope that you will join us for some of our continued educational and connection opportunities and earn some CE credits. And now I'm going to ask if there are any questions, things that we didn't cover that you need to know about. You can raise your hand, or you can drop them in the chat. Or if you like, you can join us after this session, which is more focused on, gives you an opportunity to ask questions about your own particular school communities or what you're struggling with. But if you have any questions about some of the steps that I talked about today and the programs that I mentioned, I know I covered a lot of material, so please let us know if there's anything in there that was not clear or that you have questions about. You absolutely can implement Classroomwise without additional support. Thank you, that's a great question. Yes, you can sign up for that course today. Free, you can do it on your own. It's self-guided, self-paced. You can do it all in an afternoon, or you can do it over the course of weeks, whatever works best for you. You can do it singly, or you can do it with a group in your community. The TA opportunity is if you are in a district where you're trying to get this going and you want to get people engaged and really implement this in a more comprehensive way that involves multiple stakeholders, and you're looking for more one-on-one consultation and technical assistance for this program, then you can apply for that opportunity. But please, yes, feel free to sign up for that and get started as quickly as you can. Great question. Does anyone have an evidence-based social skills curriculum for middle school age, or are one of the resources you shared, do they possibly have that? Evidence-based social skills curriculum. Let's see, I think we can give you some ideas of some of the programming that's out there. We can connect with you after the session, but if anybody seeing that knows of something that they're using, that they've heard about, that would be great. A social skills curriculum for middle school aged kids. We have a lot of resources across the entire network that are focused on those kinds of things, particularly within MTSS or tiered, other types of tiered SES programming and school mental health programming, as well as some implementation guidance for some of that programming. But if you have any ideas for Janie, let us know. And again, Ingrid will send out the slide deck, the video, information on obtaining the CE credits, and the action plan worksheet to you within the next week. Ingrid? Sorry, I saw Ingrid unmute, so I didn't know if she was gonna let me know that I'd forgotten something. Are there any other questions? Great. Ingrid, do you want to tell us about the evaluation?
Yes, again, our funding comes from SAMHSA, which requires us to evaluate our services. So I just added a link to the survey to the chat box. We appreciate your honest, anonymous feedback, which will provide information to SAMHSA and us to assist in future meetings and programs. Your feedback counts. Again, attendees providing their email address will also receive the survey 24 hours after the close of today's event, along with a video archive of today's event, the slide presentation, and information on how to obtain CE credits. For more information, contact the New England Mental Health Technology Transfer Center. For questions about our school mental health initiative, contact me or Martha at the emails listed on the slides. Thank you so much.
Oh, here it says the link isn't working. It's invalid. We'll see if we can get that figured out and get that to you, because we really do care about your feedback and we use it to sort of inform our offerings. There we go. Let's try this link. And somebody asked if there are any known groups affiliated in Virginia. I'm not sure, Elizabeth, if you mean MHTTC groups or groups focused on mental health literacy. There is a MHTTC School Mental Health Initiative that is active in Virginia. We're part of a very large network across the whole country. So no matter where you are in the country, you are absolutely welcome to use any of our resources, but you also will have a more local, regionally focused center from whom you can request technical assistance, consultation, and again, everything is free of charge and evidence-based. So I hope that answers your question. Yes, thank you. Happy holidays to all of you. We're so appreciative of the work that you do and the opportunity to spend some time with you this morning. If you are interested and have specific questions, please feel free to join us for office hours right after this session. Otherwise, we can let you go a few minutes early. Hope you take a couple minutes for yourself to care for yourself, take a deep breath, have a snack. And thank you so much for being here. Happy holidays to all of you. We hope your season is filled with peace and joy. Thank you. If you are interested in sticking around for office hours or have questions, please feel free to either raise your hand, put a question in the chat, or unmute yourself now.
And everyone,
Oh, sorry, go ahead, Ingrid.
I was just going to say, I think everyone has the ability to unmute themselves.
So if you're here and you have a question, a comment, a suggestion, an issue, please feel free to unmute yourself.
Hi, this is Janie. I was just staying to see what those resources might be that you had for the middle school curriculum.
You know what, we will have to find those for you and email you some of those because I can't remember off the top of my head.
Okay.
For particularly the middle school students. And again, you're looking for like an SEL type of.
Yeah, I'm in an SES program and we
Okay.
don't have a curriculum, and we're trying to make sure that we're using evidence-based
Sure.
activities with the students, and it's kind of been a struggle.
Has it? And I'm sorry, what state are you in?
Connecticut.
You're in Connecticut. Okay.
Yeah.
What district?
Ledgered.
Okay. I'm in Hamden, and I do know some of the Connecticut school landscape. So let me, because sometimes it's helpful to know where you are in case there are other school districts around who are using something that's helpful that they like, because it can be a source of, being able to ask people questions and get support. So
Thank you.
we are happy to get back to you with some ideas.
Okay, thank you.
Yeah, thank you, Janie. That's a great question.
Have a good day.
Thank you, you too. Anyone else have a question or a suggestion? Okay.
Yes, Martha, hi.
Yes,
I've-
hi.
Do the, pardon me, I'm trying to get this. I've signed up for all 4 of your classes in this series.
Uh-huh.
Are they all separate? I mean, they looked as if they were separate. So are they different topics as well?
Yes, they're different topics. So we're next talking about engaging stakeholders, like making sure that you're including the voices of families and educators. And I have to look at and then we are talking about, oh no, I'm sorry. Let's see. Yes, so next in January, so it's once a month. January, it's activating your power and operationalizing stakeholder engagement. And then in February, we're talking about creating a vision and a plan, and then monitoring your success. In March, we're talking about just advocacy, like the nuts and bolts of advocacy. And we'll have some additional sessions also coming up within that series. But if you signed up for all of them, it's all going to be on different topics. But we will have office hours after each of those, so that if you are working on something from a previous session and want to check in about that, you can do that. But we know that some people can do all 4, some people can just do one or the other. So
Right. Okay, well,
Very
thank
good.
you so much, and thank you for the resources, and I hope I have good news next time I see you.
I
Then
hope so, but if you have questions, reach out and we're happy to talk with you about what you're looking for, what you need, what your frustrations are, what your successes are. So yeah,
Okay,
thank you.
awesome. Okay, thank you so much. Y'all
Thanks.
y'all have a great holiday.
Take care.
Too.
Bye.
Anyone else have any questions or? Okay, it seems like